بسم الله الرحمن الرحيم. قل هل يستوي الذين يعلمون والذين لا يعلمون إنما يتذكر أولو الألباب. I want to talk to you about some practical dermoscopic features of certain inflammatory skin diseases. And as you know, dermoscopy has been widely used in the recent years to help us in the diagnosis of many skin diseases. For those people who don't appreciate the importance of dermoscopy, I'm going to show you two pictures. The one on the right is a picture of a lake that is taken through an ordinary non-polarized light. When you take a look at this lake, you see that most of the reflection of the light is on the surface of the lake, and you don't see anything or a few things beneath this surface. Another picture on the left, the same lake, but it is taken with a polarized light. The polarized light will get rid of the reflection on the surface of the lake, so that the light that has penetrated the down will be seen. So we see rocks, we see fishes which are deeper than the surface. Clearly, this type of light, the polarized light, has been used by fishermen to spot fishes. The same principle is applied to dermoscopy. Dermoscopy will ameliorate, will get rid of the reflection on the surface of the skin, on the stratum corneum, and will let us look through it into the deeper parts of the skin, so that we can see things inside the lake, not only on the surface of the lake. What are the things that we are going to get an idea and we are going to see when we get rid of the stratum corneum and the surface of the skin? What are the things? Some of these things you can imagine, like blood vessels. Today, I'm going to discuss the dermoscopic features of three very common inflammatory skin diseases: psoriasis, eczema, and lichen planus. We all meet these diseases in our everyday practice, and in most of the cases, we can diagnose them easily. We don't need to do dermoscopy to diagnose psoriasis or eczema or lichen planus. But in a few unusual cases, we meet some difficulty in diagnosing these diseases. So, without dermoscopy, if you are not sure about the diagnosis, you may go directly into a biopsy. But with the presence of dermoscopy, we can, in many cases, reach the diagnosis of psoriasis, eczema, or lichen planus in certain unusual cases without biopsy. What are the things that we are going to look that help us in the diagnosis of these three diseases and differentiating between them? Of course, you can imagine what gets below the stratum corneum and below the epidermis. The blood vessels, of course. So we look at the blood vessels, we see the shape of the blood vessels, we see the distribution of the blood vessels. Also, we can appreciate the scales. Regarding the scales, we have two important things that we can appreciate: the color of the scale and also the distribution of the scale. In addition, the follicular structures will be seen with dermoscopy, and the sixth point is that when there are certain special features and structures that we can see and appreciate by dermoscopy. For example, Wickham's trial. This is a special and important and diagnostic feature of lichen planus. Now we are going to discuss or take a look at each point of these. The first one is the blood vessel shape. We have only 4 important shapes of blood vessels. The first one on the upper left is the dots and the globules. Okay? The other one on the right top is the linear blood vessels. The difference is clear. Now, why does the blood vessel looks like a dot and a globule? This is when the blood vessel is perpendicular to the skin surface. Imagine a blood vessel that goes from the dermis upward. When you look at it from above, you see it like a small dot, or if it is large, it is called a globule. Dots and globules are the same. But when the blood vessel travels parallel to the skin surface, of course, it will be seen as a linear, a line. Some of the lines, some of these lines are non-branched, and the other is branching the left lower, the left lower. And some of these linear blood vessels are curved. So we have these 4 shapes of blood vessels. We have only 4 shapes. Now the distribution of the blood vessels. Is it all of the lesion or in some parts? One of the important distributions is the uniform distribution, equal in all parts of the lesion. The one on the left upper, this is characteristic of psoriasis. When you see dots that are uniformly distributed, it means most likely to be psoriasis. Or it could be uniform and linear, like the one on the besides it. This occurs in some disease like mycosis fungoides. Or the distribution is peripheral, only in the periphery of the lesions, like that on the B. Or the distribution could be clusters, like number C. D shows a haphazard distribution, whether it's dots and globules or linears, and E shows a distribution that is net-like or reticular. What about the scales? We have only 3 different colors of scales. The scales either are white or yellow or brown. What about the distribution of the scales? The distribution of the scales could be all of the lesion like that on the A, only in the center of the lesion like that on the B, the periphery of the lesion, C, or haphazard like D. So, 2 important features of scales that are color and distribution. Folliculars, we look at the follicular openings, and there are certain characteristic findings. The picture on the A shows us follicular plugging, like that we see in discoid lupus erythematosus, while B, the folliculars hemorrhage or red dots. Lesion on the C, perifollicular whitening, and on the D, perifollicular brown pigmentation, like in some melanocytic lesions. These are the follicular structures that we see. And of course, the 4th one was, as I told you, special features. Now, let's take a look at some of these diseases which I have mentioned, psoriasis, eczema, and lichen planus, and we try to apply what we have said before. The picture on the left is taken with a non-polarized light, and non-polarized light will reflect to you the surface of the skin. It does not go beneath the surface. And you see scale. What is the color of the scale? It is white. There are no yellow color. And in addition, you see on the left picture, there are small dots and globules uniformly distributed. But when you take a look at the picture on the right, which is taken with a polarized light, which will take a view deeper, you see it clearly. There are dots and globules that are uniformly distributed, characteristic of psoriasis. Another picture of psoriasis, dots and globules that are uniformly distributed and white scales. Another psoriatic lesion, characteristically, you see it clearly. These are not only dots and globules, these are bleeding. RBCs have extravasated outside the blood vessels. Also, a characteristic feature of psoriasis, it is equivalent to Auspitz sign. When we do Auspitz sign, there will be pinpoint bleedings. Also in this picture, you see the white scale. Now, let's take a look at, this is also dots and globules, but here, the dots and globules are not uniformly distributed, not uniformly. And we said to diagnose psoriasis, you have to see the dots and globules uniformly distributed. But again, here is an important thing about the dermoscopy. You have to take the whole picture. I mean, if you have an area which is the dots and globules are uniformly distributed, you go for it, and you forget about the non-uniformly distributed. Now, eczema, the second diagnosis, eczema. Look at the scale. The scale is mainly yellow in color. There are also white scales, but most of them are yellow in color. This is not present in psoriasis. Again, you see dots and globules, but they are non-uniformly distributed. Another picture of eczema, clear. This is yellow and white scales. The yellow scales are not present in psoriasis. And you see dots and globules, but they are non-uniformly distributed. Now, lichen planus. Lichen planus has different morphology and distribution of blood vessels. Look at the picture C. You see it clearly. There are linear blood vessels. And we said, linear blood vessels occur when the blood vessels travel parallel to the skin surface. The picture C, there are linear blood vessels, and there are also dots and globules. Picture B, dots and globules are distributed non-uniformly. Picture A, there are linear, at the green arrow, linear and branching blood vessels, while the red arrow shows us linear curved blood vessels. These are present in lichen planus, and if you see them, this makes the diagnosis of psoriasis or eczema unlikely. Now, the follicular structures are sometimes characteristic of lichen planus. The picture on C, you see follicular plugging. Similar to that, you see in the discoid lupus. Also, you see it in lichen planus. And there is picture A and picture B. You see that around the opening of the hair follicles, there is a collection of brown pigmentation. This brown pigmentation is called rosette. It means a small rose. A small rose characteristic of lichen planus. Rosettes are characteristics of lichen planus. Now, to diagnose lichen planus in the presence of Wickham striae is straightforward. So these are examples of Wickham striae. But Wickham striae sometimes take different morphological pictures. For example, the picture A is sharp sharp Wickham striae, easy to diagnose, while in the B, it is not that easy because it is dull Wickham striae, no sharp demarcation. The picture on C is called Silhouette sign. It is curved and geographical like. So it's not easy to diagnose Wickham striae in every case. But for an experienced eye, you can reach a diagnosis. Again, radial streaming of Wickham striae, picture on A, instead of the reticular configuration, which is characteristic of Wickham striae, which you are seeing on the picture B. Picture A shows us radial streaming. Okay, the D is characteristic. It is globular, called globular Wickham striae. So, in conclusion, again, there are different morphological features, strange and interesting features of Wickham striae. For example, C is the annular-like Wickham striae, and B is reticular Wickham striae. So, in conclusion, we can say that in many cases that are unusual or difficult to diagnose, common inflammatory diseases like psoriasis, eczema, and lichen planus, dermoscopy has an important role in differentiating these important and common entities, and will save us the time and effort and the expense of doing a biopsy. And thank you very much for your listening.